Hello, my name is Conway-Braxton, and this is my PowerPoint on the life cycle of an insurance claim. The life cycle of a claim includes patient pre-registration, established financial responsibility, patient check-in and check-out, the Superbill or encounter form, prepare and transmit the claim, monitor payer adjudication, and patient collections and the law. Patient pre-registration. When a new patient calls to set up an appointment, they pre-register for their visit. A new patient may give personal and insurance information to pre-register and ensure that they are eligible to receive services offered by the provider. Information that will be needed to complete pre-registration include medical history, employment, and insurance information. If the patient has seen the provider before, the information is already in the system. They would only need to explain the reason for the visit. When the patient arrives to the front desk, the staff will obtain a copy of the patient's insurance card. Establish financial responsibility. Once the information is obtained from the patient, verifying eligibility and benefits to determine the patient's coverage is completed. The provider office will know what portions of the services provided are paid by the insurance and the patient responsibility. The steps to verifying insurance includes obtaining a copy of the patient's insurance card. If the patient does not have an insurance card, you must obtain the ID number, group number, the insurance company's name and phone number, and the insured party's name and date of birth. Contact the insurance provider, determine the insurance coverage, and determine the patient's responsibility. Patient check-in. A new patient is someone who has never seen the provider before or a patient who has not seen the provider within the previous 3 years. The new patient will have to fill out the appropriate forms and provide an insurance card along with the identification such as a driver's license. An established patient is someone who has seen the provider within the previous 3 years. They will confirm the information the office has on file. Co-payments, deductible, or any additional charges resulting from procedures during the patient visit may be collected by the front desk at check-in or check-out. Patient check-out. During the check-out process, the staff will schedule follow-up appointments, provide the patient with an after-visit summary, collect any co-payment not collected at check-in, and collect any payment towards an open balance on a patient's account. Some checkout procedures include helping the patient schedule any type of diagnostic or laboratory services depending on the organization's process. If the patient needs a referral or authorization for additional services, this information will be given to the RN or MA who are responsible for completing these requests. The Superbill or encounter form. The Superbill is the main source for the creation of a healthcare claim that will be submitted to the insurance plan for processing. It is used for each visit to record vital information for billing purposes and to reflect services rendered to a patient. It can be used in paper format or electronic format. If using the paper format, you will fill in the patient's information and attach it to the medical record for the healthcare provider to complete during the visit. If using the electronic format, the healthcare provider will electronically complete the information, which is then transmitted to the medical coder to ensure proper coding before transmitting to the medical billers to review for error. Each physician office creates a Superbill to match their office specialty. The Superbill includes patient information, dates of service, ICD-10-CM and CPT codes, physician's information, and physician's signature. Prepare and transmit claims. Claims provide an accurate record of the services provided by a healthcare professional or hospital. Each claim form requires essential information such as patient information, patient medical record and account number, subscriber information and number, group or plan number, secondary insurance information, prior authorization or referral number, rendering service provider name and rendering service provider NPI, dates of service, diagnosis and procedure codes, revenue code, itemized charges for services rendered, number of services or units of service provided. A medical biller then takes the Superbill from the medical coder and put it into a paper claim form or the appropriate billing software. The biller is responsible for making sure that the claim meets the standards for coding and format. Submission steps include the medical biller reviews the information submitted by the medical coder. The medical biller verifies all the proper information is present. The biller will transmit claim to a clearinghouse or directly to the insurance provider for processing. If the claim form is missing any information or the information is invalid, the clearinghouse will reject the claim and return it to the provider's office for corrections. The medical biller then corrects the information and resubmits the claim. The medical biller may choose to send a claim directly to the insurance provider for processing. Once the insurance provider receives the claim, it is reviewed and processed per the patient's benefit plan. The insurance plan will either pay, reject, or deny the claim. Monitor payer adjudication. Part of the adjudication process includes whether the payer accepts, denies, or rejects a claim. An accepted claim is one that is found valid by the payer. It does not mean that the payer will pay the entirety of the bill. A rejected claim is one that the payer has found some error with. If the claim is missing important information or if there is a miscoded procedure or diagnosis, the claim will be rejected and will be returned to the provider or biller. In this case, the biller will correct the claim and resubmit it. A denied claim is one that the payer refuses to process payment for the medical service rendered. This may occur when a provider bills for a procedure that is not included in the patient's insurance coverage. Once the payer's adjudication is complete, the payer will send a report to the provider or biller detailing what and how much of the claim they are willing to pay and why. This report will list the procedures the payer will cover and the amount the payer has assigned for each procedure. Generate patient statement. Statements are sent monthly on the same day. It needs to be a consistent process to aid your accounts receivable for patients. You will print the statements for 30, 60, 90, and 120 days. 30-day statements are ready to go, but the office may consider reviewing the statements as the patient may not have a balance and the office is waiting for the remaining balance to be paid by the insurance plan. 60-day statements receive a sticker or handwritten message stating the account is past due. 90-day statements, before sending, the office may call the patient informing them that they will be receiving a final notice statement, and if not paid by a certain date, the remaining balance will be sent to a collection agency for further action. 120-day statements are if the patient has not made any attempt to make a payment or set up a payment plan. It will be time to review for collections. Some offices will review the balance and determine if it is better to write off the balance as bad debt. versus sending for collection. If the office decides to write off a balance, it is better practice to notify the patient this action has been taken. Follow-up payments and collections. If the office determines a patient balance is too large to write off, sending it to a collection agency is the next step. When the medical practice turns over their account to the collection agency, the office must follow the rules of the agency. The medical practice will close the patient's account and will not send out any further bills to the patient. If the patient makes any contact with the office, they will need to be referred to the collection agency. If the medical practices receive any further information from the patient, that should be communicated to the collection agency. As part of the collection process, it is vital that the office administrators and medical billers know and understand the Fair Debt Collection Practices Act. The Fair Debt Collection Practices Act is enforced by the Federal Trade Commission and prohibits debt collectors from using abusive, unfair, or deceptive practices to collect from a consumer. A collector is someone who regularly collects a debt owed to others. Collectors include collection agencies, lawyers, and companies that buy delinquent debt. It is important to interview and read the reviews of a collection agency before contracting with them. You want to ensure your patients are treated with professionalism and respect despite being delinquent in their accounts.